Hi, my name is Maria Davis. I am an AIDS survivor of 25 plus more years. I'm also an HIV AIDS advocate. I'm also the godmother of hip hop because I'm in the music industry. I do a monthly showcase called Mad Wednesdays, which started 30 years ago. So I'm celebrating 30 years. And I am also a ministry leader at First Corinthian Baptist Church in Harlem, one of the largest churches in Harlem. And they do great community outreach work. And I'm out here in the streets trying to save lives, register people to vote, and voters engagement, whatever I can do while I'm on this earth to push people to be educated and to empower their lives. So my journey and my introduction to HIV was fairly finding out through a life insurance policy, not thinking I can get HIV because at the time I was diagnosed in 1995, we knew it as GRID, gay-related disease, and we also did not think that African American women would be able to contract HIV. We didn't think it was a black disease. We thought it was white people's disease. And lo and behold, as the numbers became bigger, then it became the face of African American women. Not being educated, not knowing any information. The only thing I knew about HIV was Magic Johnson had it, and a little young child at the time, Hydea Broadband, and Eazy-E from a group called NWA. And so there was no information. So when I was diagnosed, I did not immediately go to get it reconfirmed because that's one thing people don't know. When you first do an HIV test, it's a preliminary, and then you go and you get retested to be a confirmatory. And so I did not do it immediately. I just wrote on the letter. It came an insurance company policy. I wanted $100,000 life insurance policy because I had 2 children who are not infected. And if anything happened to me, I wanted to be able to take care of them. But for you to get a $100,000 life insurance policy, there were certain criteria. You could not have HIV, nor could you have cancer. And so when the man said to me, you have to take an HIV test, I said, oh, no problem. Took the test. Letter came back 10 days later. Dear Ms. Davis, we're sorry to inform you, you've been rejected for the life insurance policy. But we found HIV antibodies in your blood. Please go and seek help. And I read that letter standing in the middle of a post office and reading that with no support, no information, no anything. So, I immediately said, this is not God's plan. God has another plan for me. He did. But, it took time to find out what that plan was. So I still continue. My Mad Wednesday has started in 1994. At a club called Sweetwaters. And so Mad Wednesdays was being developed and getting good. And I was started to get great artists, Jay-Z, Sauce Money, Black Girls, Brandy. A lot of the artists from back then had graced Mad Wednesday stage. And so I kept it a secret for a while. And then maybe a month later, I decided, because I was in a relationship with a male partner, and I started thinking like, it's not fair for me to know I'm HIV positive and then don't tell him. I have to find out. Plus I have 2 children, so I have to find out if this is true or not. And so I went into the health department, both him and I, and at that time, we didn't know the information that we know now, that it's harder for a woman to give HIV to a man than it is for a man to give it to a woman. They found that out later on down the line. And so we both got tested. We came back for the results because back then you had to wait 14 days to get your results. And they said he can go in the room first. And I was like, sure. And then he came out and he said, oh, I'm HIV negative. I was like, yes. So if he's HIV negative, I know I'm HIV negative. And lo and behold, the lady said, you want to come in for your results? I said, yes. And she said, your partner doesn't have to come with you. And I said, no, you can come with me. Because I knew that because he was negative, I was going to be negative too. And she said, Ms. Davis, we're sorry to inform you that you are HIV positive. So that was a whirlwind. And the counselor at the time, God bless her, you weren't supposed to take people to the side. You were just supposed to counsel them. But she said, I'm going to do this and I'm not supposed to. But this is going to help you on your journey. And she pulled out a Bible and she started praying with me. And I wish I knew where she was today, because this is years later and I'm still here. And the prayers that she prayed for me really manifested to why I am here, almost 30 years later.
Is that why you got involved with the church after your diagnosis and meeting that counselor?
No, that did not happen right away. I kept it a secret for a very long time. I wouldn't tell anybody. I was with Puffy, Queen Latifah, anybody you could think of came to Mad Wednesdays. And at the time, I was losing a lot of weight because I wouldn't take medication. At the time when I was diagnosed in 95, there was no medication yet. The only medication was AZT, which was a failed cancer treatment. And that was the only hope people had. But of course, in the community, it was like, do not take AZT, do not. And then I saw what it was doing to people. Their skin looked like they were burnt. Their nails were dark. They had baby thin hair. And I didn't want to look like that. So when medication finally did come out, which in the beginning, they were very toxic, but I hadn't started my treatment. Mad Wednesdays had to end by 1998, September. I will never forget, because I had lost so much weight that I then found out, and being so fatigued, this particular doctor where this clinic I was going to had said to me, have anybody ever tested you for MAC? And I was like, what the heck is MAC? She was like, Mycobacterium avium complex. And I said, no. And so she tested me. It was at the Callan Lord Clinic. I will never forget that. And she tested me, and I came back. And by that time, I was getting these fevers. And she called me in the office, and she said, you have MAC. And I said, MAC? And I didn't only have it in my bloodstream, I also had it in my bone marrow. And so Mad Wednesdays had ended. And then I was introduced to a doctor named Joseph Sonabin. They said he was like the leading doctor in HIV, but he was private for all the years. And then he decided he was going to go and work in the clinic. So I was going to Caprini Clinic where he was. And I had became so very sick because the MAC had just consumed me. I was having fevers morning, noon, and night. After the fevers, I was having night sweats, wetting up my bed. And so he finally had to admit me in the hospital on January 29th, 1999. I'll never forget that date. And it was for like a maintenance, like to get me back on the health track because I was very fatigued. And that week turned into 6.5 weeks. So I did not leave the hospital until March 10th, 1999, because they had started me on the new medications, but they then did not know what they know now. When somebody is sick and they're HIV positive or living with, you treat the infection first, and then you start the medication. They started the medication and the treatment for MAC at the same time. So I had sores all over. I was a hot mess. So my journey, then I caught neuropathy from my knees down to my feet from the HIV medications. Like I said to you, then they were very toxic. I went down to 95 pounds. My head was bigger than my entire body. So I had a very, very long journey and a very, very serious fight. And learned a lot of lessons. Very much educated by Dr. Joseph Sonabin, by Dr. Teresa Mack. And at that time, I was going to an organization called Friends Indeed. They no longer exist. And this was an organization that took care of people with HIV and cancer, but mainly HIV and AIDS. And they would do groups. And at that time, it was a lot of men, gay men. And I would just sit in the back of the room and just listen and say, when am I going to feel empowered to be able to tell people that I was living with, at that point, AIDS? And I just kept listening, still refused to take medication. And this one of the pharmacists that was there that did holistic took me in a room. They did a emergency crisis counseling, took me in a room and said, I'm gonna talk to you like you're my sister. If you don't start HIV meds, forget holistic right now. Your T cells are at 5. So a normal T cell count is 500 and better. I had 5. And so with having 5 T cells and being diagnosed with an opportunistic infection, that is what gave me the AIDS diagnosis. So those two things have to happen. People don't even understand that. There are many people that live with HIV and never contract AIDS. But because I had the opportunistic infection and my T cells were under 200, that made me a candidate as an AIDS diagnosis. And so he said, if you don't get to this hospital and you don't see a doctor and start a medication, you're not going to see your kids. And it was like, I never thought about that. I thought about surviving, but I didn't think that I wouldn't see my children graduate. When my daughter was in elementary school, my son was in junior high school, I wouldn't get to see them graduate. I wouldn't get to see them go to college, nor would I get to see any grandkids, which I have 2 now. And so, you know, it was a journey. It was a powerful one. It had many nights of crying, fighting the stigma. You know, back then it was like if you was HIV positive or you was diagnosed with AIDS, you either prostitute or you use drugs. So the misinformation. And had a lot of good people along the way, like Deborah Levine, who was one of my go-to people. You know, it's so funny. I tell people when I had Mad Wednesdays, so many people came through Mad Wednesday's doors, and some of those people then turned into counseling and counselors for HIV. And Deborah was one of them. She worked at HCCI. And I got involved with the Black Church Week of Prayer for the healing of AIDS because of her, and the Balm of Gilead with Vanessa Seal and Deborah Frazier Hauser with the National Black Leadership Commission on AIDS, and Mother Ella and Miss Dolores Moon. And all of these great women really nurtured me and educated me, along with Dr. Joseph Sonneban. He was a white man from England. And when they first told me about him, I said, what's this white man going to tell a black woman about HIV? He don't know my struggles and where I come from. But he was very serious. His point was education, and that I get in on a treatment plan, and that I stayed on that treatment plan because I used to love to do drug holidays. That means you took drugs and then you decided I was cute because I was doing little magazine covers with Cheryl Lee Ralph, Heart and Soul, and I was doing this and doing that, modeling in HIV. So I felt like, oh, I don't need this medication because I look good. Wrong answer. You have to stay in a treatment plan. You have to see your doctor. You have to get your blood work done every 3 months so that you know what's going up, what's going down. Do you have high cholesterol? And now I am elderly. That's what they say. I don't feel that way. You know, I'm 65. I just made 65. And, you know, now I'm not just worrying about HIV. Now I'm worrying about the other stuff, the arthritis, Arthur. We call him Arthur. And, you know, and it also puts you at a higher risk to get cancers, different cancers. And so that then propelled me into working with Columbia. And I'm on the Herbert Irving Cancer Cab with Kimberly Berkeley, Kazim, and some Beth, some great people, and I'm on the Cancer Cab. And I wound up graduating, took a course with them. It was called Disrupt. So I am a community scientist, CSI program, where they took us for 6 weeks at City College and put us in front of a lot of professors, researchers, clinicians, estheticians to talk about the burden of cancer in the African American community and why we are diagnosed in later stages. And so getting that information and taking that class was so eye-opening. The first day of my class, in 2023, the first day of my class, my girlfriend died of breast cancer. Very dear friend named Jacqueline Norman. died of breast cancer. And it had metastasized everywhere because, you know, when they first told her that they saw something and she needed to go to the doctor and get it checked out, it was during the pandemic. So she didn't think that, you know, the hospitals was open and things was going on. And so I had the task of taking her to appointments, not knowing that she had cancer, just thinking that it was, you know, maybe an infection or a virus or something that she caught. And it wound up being in her back, in her lymph nodes, in her liver, a little on her brain. And it's just, which really made me not only want to also talk about cancer, but lifestyle change, changing the way you eat, because the food is not our medicine. The food can be medicine if you make certain changes. You know, I'm not telling people not to eat meat, but vegetables are very important. You know, your gut health, you know, you put a lot of inflammation in your gut health, and your gut can determine what your outcome is, your health outcome. And so, you know, being in a program called Heart Smart with a young African-American woman named Dr. Teti, taking it on the churches, educating us about the way we eat, you know, food for life, you know, What the Health, Food Inc., Soul Food Junkies, just really educating us. Is it an easy journey? No, it's not. Because I like fried chicken. I like macaroni and cheese and potato salad and sweet potatoes, but you can't eat that like forever. And food has become a business. It's not even about the mom and pop farmers that we used to have where it was grown in sacred soil. You know, a lot of the stuff that we're eating is toxic. And so, you know, the journey has been started with HIV to AIDS, to holistic, to learning about how to take care of myself with HIV, then to what are these other health disparities in our community? You know, we're number one at everything: high blood pressure, diabetes, prostate cancer. I even get the prostate cancer truck now. I partner with Errol Webster at Mount Sinai, the Robert F. Smith Mount Sinai prostate cancer bus. And so I schedule that as many times as I can, go in different places. I work with the American Italian Cancer Foundation, scheduling the mammogram bus at First Corinthian Baptist Church. But I also worked during the pandemic to help many seniors get their vaccines and then get their boosters. I worked with Ryan Health. I worked with the National Black Leadership Commission on AIDS, wherever there was slots. You know, I became a friend of the seniors. You know, once you call one senior and say, "Oh, I have an appointment for you to get your first vaccine," it was like fire. And so I have a lot of senior citizens, seasoned seniors in my phone book now. So, you know, the journey has been a great one, lots of education. And I say to anybody, whatever you're going through, whatever that illness is, it does not define who you are. You're still powerful. You know, I believe in God, and I'm not pushing that on anybody, but grace, mercy, but God. That's what I say all the time. And, you know, sometimes you have to go through something to really find out what your real purpose in life is. And, you know, I found my purpose. I thought it was Mad Wednesdays, being on the stage, knowing all the celebrities, but it was just the groundwork for me to be a speaker on another stage, which was HIV and AIDS first, and now for health. Because, you know, I'm a health bully. I got my megaphone. I be standing on the corners telling people, "Oh, did you get tested for HIV? Have you had your health screenings? Once you reach 40, there are certain health screenings you have." I work with Deacon in my church, Deacon Laverne King. She's with a program called Choose Healthy Life. I work with her, and we try to, you know, get people to understand what your blood work means. When you go in the doctor's office, write down your questions so that, because, you know, because of these insurance policies now, they tell you only have 15 minutes with your doctor. No, you don't. I tell them, arrest me. When I get in the doctor's office, if I have to be in there 30 minutes, I'm sitting in there 30 minutes until I can get the answer that I need, that makes me feel comfortable and satisfied. And if you're not getting those answers, choose another doctor. So that's been my journey. Education, information, healing, learning to love myself, because that's so important in a journey that you learn to love yourself. I learned to love myself after my diagnosis. Oh, that's a word right there. Learning to love yourself after your diagnosis. And
That's how you ended up here.
that's how I ended up here.
Wow.
World AIDS Day is coming December 1st. And we have to get prepared to give the messages out. You know, that people living with HIV, you're still whole, you're still loved. You have a mission. I'm not telling everybody to go out there and, you know, be a voice on the street like me, but it's important that you get the information and you have to share it with your family members, with people, your loved ones, with your community, your neighbors, young women, our young men, whoever they love. Just empower them with the information so that they don't have to go down the same road I went down. And you know, the stigma is still real. People are not talking about HIV. They think, young people think that, I had one person say, what's HIV? It still exists. Yes, it does. And it's a preventable disease. And if you do not have the information, you can get caught out there. And the first information is how important it is for you to love yourself. That you don't let anyone talk to you, bamboozle you, try to get you to do things that you know are not right. And drugs also has a lot to do with decision making of people. Sometimes we try to numb our darkness with drugs and alcohol. Well, when you numb it and you come back down off your high or you come back to consciousness, it's still there. So you have to address whatever that issue may be. I think the stigma is not like when I first got diagnosed. Absolutely not. You know, I helped educate people. Deborah helped educate people. So there was a lot of education, but the lack of education is what I want to talk about. That's why the stigma continues, because now people have let their guards down, thinking that HIV is not around, but it is still around. Has the numbers gone down, increased, yet decreased? Yes, it has. The numbers have decreased in the African American community, but we still have the highest numbers out of any other culture. And it's a shame because we keep hearing, I'm going to say it like this. They think that the old HIV and AIDS is gone. That's when people were dying left and right. You know, people were doing radical stuff. Well, I had people tell me, oh yeah, they wouldn't address the AIDS back then, so we threw our family member over the fence at the White House. Yes, they did radical stuff back then. You had ACT UP, you know, you had Larry Kramer. They were doing, because people were dying. And now because people are not dying like that, people are still dying, but they're not dying in those large numbers. But to have one death is still a problem to me. So the stigma may not be as high as it was back then, but it is still stigma. And people are still asking me questions. People still don't know the difference between HIV and AIDS. Oh, I'm going to get an AIDS test. No, you're not going to get an AIDS test. You get tested for HIV. Is the virus that breaks down the immune system that causes AIDS. So AIDS is not really a disease. AIDS is what happens if you don't take care of yourself and get into treatment. So we still have a long way to go. There's still much more education that we need to do. It needs to be in the schools. They're not educating our young people in school properly.
Right. I think there's a lot of conversations about, abstinence, safe sex, getting STD tested, but nobody talks about HIV testing and that might not be in that full panel that you request.
Absolutely. Absolutely. And that you have to request it, but you have to, HIV is not the monster anymore. Remember when it first came in our community, the African American community, they called it the monster. It's not the monster. The monster has been put to sleep, and you can live with HIV, but why would you want to get HIV? Because the medication is phenomenal now. There are mild side effects. But the problem is, why do you want to interrupt your life by having HIV, because you still got to take medication the rest of your life to keep it under control.
And you're at risk.
And you're at risk
for other infections.
For other infections. Now I am 65. Now I have to think about other things. You know, that C word, that cancer word is deep. But now you are more at risk because you're older and your immune system becomes compromised. So you can't fight like you used to fight. I fight every day. So that's a misconception for me. But you know, your body doesn't fight back like when you were 10, 11, 12, 20, 30. So you know, you have to do whatever it takes to keep your body healthy, your immune system healthy. I mean, it's no way around it. Because you should be able, if you're with someone, you should be able to have these conversations. I don't even understand how you could be with someone and then be uncomfortable of talking about a person's sexual history. You know, if we are sleeping together, that's important. Because everybody that you slept with, now I'm sleeping with. If you're carrying something, we're not just going to talk about HIV, we're going to talk about herpes. And how herpes, what happens. And you don't have to have an outbreak. You don't have to see an outbreak on somebody for them to infect you. Or it's a shedding process. And so herpes is a big thing right now. There are many Americans with herpes because people did not have that conversation. Herpes is like a silent disease. You really can't see it. You just cannot. And then HPV, that's another one that it can be spread and you don't know it. And so this is why you have to have a sexual health conversation with anybody you getting ready to see. I tell people all the time, your first date should be to the health department. And I don't want to see no back papers of no old health records that you had. No, me and you together are going to go to the health department so that we can know that we're both healthy. Because I want to marry, if I'm getting married or being in a relationship, I need to know whatever your health disparities are, whether it's high blood pressure, because I don't want to be caught out there and, you know, you pass out and I don't even know why you passed out. So we should know our health history together if we are in a relationship.
Great. Thank you.
Wow.
I think framing it in a way of like our health history in general, not focusing on the sexual part,
right.
That's what makes it a little bit easier to have that conversation.
Yes. Not saying who you slept with. It's saying, you know, I would like to know how are you health-wise? Right. And health encompasses everything. I need to know if you got bad teeth because that can affect your heart. See, people don't know that kind of information.
I need to know if you have diabetes, if your blood sugar is going to start spiking or dropping.
And do I need to know that you have diabetes so that when we're out eating, I'm not going to badger you, but I'm going to say, maybe that's not the best health choice. Because I want you to live. Because when you live and you feel good, I'm living and I feel good. As well as me taking care of myself, if we're in a relationship, I want to make sure that you're taking care of yourself too. It's a relationship in all matters, not only in sexual, but in whole health, financial health, mental health, and spiritual health. Have a conversation. You need to have conversations with your children, your grandchildren, your family. It's holiday season. Sit down at the dinner table or lunch or breakfast, whatever you have, and talk about the ways of life. Like my mother didn't talk to me about the birds and the bees. And it can be age appropriate. You know, make sure nobody's touching you, you know, to our young women and our young men. Make sure that they know that they are loved. Make sure you keep your children off of social media with all of this misinformation that is surfacing. You know, AI is a great thing, but AI is going to be an enemy too because it gives out false information too. It's mimicking people. I saw AI that somebody said was of Obama, Barack Obama. So you still have to do the research. Don't depend on other people's information. Do your own research. You have a phone, Google information. Google the numbers. What are the numbers for HIV in whatever community that you're in? Get that information. Talk to your children. Seniors, ooh, let me talk about seniors that are having sex. That the STI numbers are very high in the nursing homes because seniors still feel, we still want to be loved too. And seniors are under the misconcept that they can get HIV because you're older now. No, it's a virus. You have sex, unprotected sex, you can get HIV. And I know that they have PrEP. PrEP is a great tool in the tool shed, for people that might not, that are sexually empowered. I want to say that. And that they feel that they love sex, that they need the protection of PrEP, but with a condom. Whatever you need to do to protect yourself, because this is your temple, you only have one. You mess it up. Sometimes you get a second chance, sometimes you don't. Sometimes the body don't. Everybody responds differently to illnesses. First thing I want them to take away is how good I look. And that's because I take care of myself. That's because I see my doctor regularly. And whether it's HIV or whether it's my foot, I had foot surgery, that you take care of yourself, your whole health. And as you take care of yourself with your whole health, make sure that your loved ones, whether they're HIV positive or that they're not, and make sure that they're taking the proper steps to keep their health, to stay healthy. But HIV and AIDS is not a death sentence anymore. It is a curable and a preventable disease. Not curable. HIV is, strike that. There's no cure for HIV. But you can live longer and you can live healthier because the treatment plans are more advanced than ever now. But also know that you should love yourself enough that you ask the right questions, that if you're going to sleep with someone, to make sure that you have all the right information. And even if you do have the right, wear a condom. Protect yourself at all costs because there's only one you, and love you enough to know that there's only one you.